Good morning. It is 6:45. I'm just waiting for an Uber to take me up to the day surgery clinic. I slept really badly last night. I fell asleep probably just a little bit before midnight, and I kept waking up from like just after 3 a.m. And like, to me it felt like I was waking up every maybe 20 minutes. I just couldn't stay asleep, so that's annoying. I don't feel tired at the moment. I feel, pretty much wide awake. But I know that's because anticipation, basically. So, Uber's 5 minutes away. I think I will go and hang out front until they get here. I've just had a chat with the admission nurse, got my gown on. I was trying to put my compression socks on and literally struggled. Like, I couldn't get it on. But one down, one to go. This is not as easy as it looks. Done. Oh, hello. Oh, look at me. I'm seeing myself for the first time since surgery. My eyes are a little bit blurry, a bit tired, but that's to be expected. I feel really good. Like, I don't have any pain, I don't have any discomfort. My throat doesn't hurt. I was told it might hurt, but it's fine. I think it's just, croaky because I'm tired. But no, I feel really good. And yeah, the bandages aren't as bulky as I thought they would be. Pretty happy. I feel really good. The nurses are lovely. The anesthesiologist was lovely. Surgeon's lovely. Yeah, I'm happy. I'm a happy little chappy. And they're also making me coffee and bringing me sandwiches, so good. Everything's great with the world. Oh, okay, so I am home. Looking fabulous. I am pretty cold, but that's just because I've gone from being in a really warm hospital bed and then chair to outside, and now in my house. So I've got the heater on. Mum's just sort of setting me up and babying me, which is kind of nice. But I don't feel bad. I'm a tiny bit nauseous if I move around too much, but it's not like I don't think I'm going to lose my lunch or anything. I do have a really dry mouth, and I find that I was trying to eat the sandwich, and it just really hard to chew because my mouth's not producing the saliva it needs to help break down the food. So they're small things that I'm kind of experiencing now, but no pain, no discomfort. I am tired, so I probably will have a nap, but that'll all just be the general anesthetic doing its job, so no surprises there. I was really nervous about having the general anesthetic. It was my first time, but it's not an unpleasant experience. I can't remember if I talked about this earlier. It's kind of hard to remember what happened since I woke up, but after they took me into the operating theatre, they asked me, a little bit about YouTube and stuff like that, and I think mostly to sort of distract me from putting in the what are they called? The drip thing. so they put that in, and then they administered the general, and I remember like I could feel it going in because it's cold, and then I remember like just my vision going a tiny bit fuzzy and feeling really nice, and I literally said, wow, that works quick. And that was the last thing I remember, and then I was being woken up. So like it works really fast, and it wasn't an unpleasant experience. Hey guys, so I just woke up from like 2.5 hour nap, and I'm still so tired. Like I could go straight back to sleep, but I'm really hungry, so I'm gonna get up and eat something. And the nurse, she does want me to walk around a bit because I am wearing these compression socks for a little while, so she wants to make sure that I maintain blood flow in my legs. It's really hard to sleep sitting up. It's kind of uncomfortable. So yeah, I think that's all at the moment. No pain, which is good. The longer I go without pain, the better. Okay, so it is after 10 p.m. What time is it exactly? It's 12 past 10, and I wanted to check in to let you know that I am feeling pain. So that's, you know, that's a thing. We knew it would happen. So I think I had about 12 hours pain-free post waking up. So obviously when I first woke up I had no pain. They let me like sleep, and they would check on me every now and then, wake me up again and talk to me, and then let me go back to sleep. But I'm pretty sure I was out of surgery and awake by about 10 a.m. Maybe even a little bit earlier, I'm not sure exactly. But yeah, I think I've had about 12 hours pain-free. Local anesthetic definitely does a good job. I thought maybe about an hour and a bit ago, like maybe an hour and a half ago, I was like, I would feel something. It wasn't pain, it was just like a discomfort, and it would sort of go away as quickly as it came. And then probably about half an hour ago, I started to think, they're consistently uncomfortable. And now, like within that time, the local has worn off even more, and they are much more uncomfortable. This one hurts more than this one, and that is probably because this one stuck out more, and I believe it needed more work. The surgeon told me that the bowl, I can't remember the actual technical term for it, but it's like the bit where the actual ear sort of dips in. It looks like a bowl. I had more of that on this side than I did on this side, and he wanted to take some of that away, as well as, like, you know, do whatever he needed to do to the cartilage that he was going to do on this ear. So I'm not surprised that that one would be a bit more sore, because it's had a bit more like in-depth work done to it. I don't really know how to describe the pain, which is frustrates me, because I want this vlog to be helpful for anyone who's like going to potentially have the surgery done and wants to know all of the things. But I would kind of like, I kind of liken it to if you've ever, like if you've got ears that stick out and you've ever like laid on one side for too long and you get that pain. I don't even know how to describe that pain. It's just like that pain. But I'm sure if you've had it, you'll know what I'm talking about. It feels like that. Not as bad, however, I still think the local is like doing a little bit of work. So yeah, it's not like a stinging pain or a throbbing pain. It's just like, I don't even know how to explain it. It fucking hurts. It just hurts. That's all I can really like put it down to. Okay, so day after surgery, I woke up probably, I think it was just a tiny bit before 10. Last night I had the worst fucking sleep, and I honestly don't really think it was because of my ears. I didn't fall asleep until after 3:30, probably close to 4 a.m, and then I woke up just before 10. Because I have to sleep like propped up on the pillows, it really hurts my back. Like, it took me fucking ages to sort of find a comfortable like pillow layout. But I find like when I haven't had surgery, if I lay in bed for too long, or if I sleep in too long, my back gets really sore. And that's what I was dealing with yesterday, and I think it was simply because I spent so much of the day laying down. So by the time it was like time to go to bed, my body was like, no, you have to get up. So, but I didn't. I eventually fell asleep. The painkillers, I can't remember if I updated this last night. The pain last night was much worse than it is today. I took I took a half of one of the codeine tablets that they prescribed, and it didn't do anything, so I took the other half, and that took the edge off for maybe half an hour or an hour, and then I just took a Mesindol because I thought maybe I just need a little bit more to like sort of just take the edge off that, like, yeah, I don't really know how to describe the pain, but it was really uncomfortable and sort of hard to, you know, not pay attention to it, which I think kind of makes it feel worse. So I took one of them, didn't touch the sides, and at about, I think it would have been about 3 a.m, I took another whole 30 milligram codeine tablet, since it had been well over 4 hours since I took the first one, and that took the edge off, and I was able to fall asleep not too long after that. So I woke up and I didn't have any pain when I woke up except my back, and once I got out of bed that stopped hurting. So this morning I haven't taken a painkiller because I don't feel like I need it. The pain, sometimes it will feel bad, but then it sort of eases off. So I'm not going to take a painkiller unless I feel like I need to take them, because the 30 milligram ones, like, they are strong, and I know that they can fuck with your body if you're on them like too often and for too long. So I prefer to just take them when I really need them, and then not have any of the like shitty side effects that can come with like high doses of codeine. So yeah, I'm feeling all right now. Okay, Tuesday night update. Fuck, I look like I'm stoned. Basically am. So I had a call from one of the clinic nurses today, and she wanted to know how I slept last night and how I was feeling today, how I was going taking the painkillers, and I told her everything, how I slept really badly, how I wasn't taking many of the painkillers. She told me that it was ideal for me to sleep propped up for at least 2 nights, but if it was causing me too much pain, that I can sleep laying flat as long as I have my head propped up on some pillows. So that's great, because I really struggled last night, and she seemed concerned that I didn't sleep well. I don't think she really liked that. I think she was like, you've got to sleep, you've got to get the sleep. So yeah, I haven't been in bed all day today, so I think I should be okay to sleep propped up tonight. But if I wake up during the night and I'm in pain, I'm just going to lay the fuck down. She also encouraged me to take the full dose of the codeine tablets, which I did tonight when I had dinner, and that's why I look like I'm stoned. I feel very spaced out, but it's not a bad thing. I have no pain. I feel very comfortable. I feel very relaxed. And I'm looking forward to just laying down and watching some television. The pain is funny. Like, it was fine all day. Like, it wasn't bad at all. And it wasn't until it got later in the day that I was really noticing it. And I think that is because it's almost like it's wearing down your tolerance. And that's the only way I can really explain how I felt about it today. But I'll see how I go tomorrow. I'll probably do the Panadol thing, and if it does get worse, I'll just take another painkiller. Like, it's not a big deal. But I feel pretty good. Of course I would. I've got 60 fucking milligrams of codeine in me. Anyway, I'm gonna go to bed. Wednesday night check-in. It's like 11 o'clock, and I'm thinking about doing the one thing that I have struggled the most with since having this surgery, and that is going to fucking sleep. So last night, as you'll know, I was medicated very well, and I fell asleep easily, but I woke up at 4:30 in the morning and my back was fucked. Like, seriously, so fucking painful. And like, there's nothing I could do about it. My body was telling me to just roll over, but I couldn't. So I had to sit up. In bed 20 minutes. I waited in the dark, waiting for that fucking pain to go away, and as soon as I laid down again, it came right back. Oh my god, I was so, like, I could have just cried with frustration at that moment. I was so fucking frustrated. My ears felt fine. Like, the thing that should be hurting me was not hurting me. It was my goddamn back betraying me. So I took 2 more painkillers. I sat up and I watched a TV show until I felt like I was going to pass out. And then I laid down and I didn't wake up again until 10:30. And when I woke up at 10:30, it wasn't because I felt refreshed or great. It was because my fucking back was killing me. Sleeping on my back is just, like, I can't do it. I fucking can't do it. I don't know why, but it just does not, like, no. Fucking, my body will not have it. Just not having it. So I thought, fuck it, I've got to do something, because if I don't sleep, I'm going to go fucking stir crazy. So today I had to take my mum and my nephew to a doctor's appointment, and while I was hiding in the car with this glorious thing, I asked them to duck into a chemist and grab me one. I'm hoping and praying that this will manage to like keep my fucking head elevated enough and my ear off the fucking pillow so I can sleep on my side, because if I don't sleep just at least like, you know, all I need is like 7 hours. 7 hours would make me so happy. That's all I want. That's all I want. So yeah, that's please work for me, little pillow. Alright guys, I'm gonna go to bed. I feel really tired. I look so ridiculous. Today I am not as foggy. I am more aware of like what's going on around me, and I'm more aware of how I look. Oh my god, I look ridiculous. Oh well, it'll all be worth it in the end, and I don't have to wear them for too much longer. I can't wait to wash my hair. I cannot fucking wait to wash my hair. Okay, Thursday night check-in. My ear hurts. So last night I did sleep with this guy, and it really helped me. I tested it over 2 types of pillows. So I've got these grey ones, and they're like big, fat, soft, fluffy duck down pillows. So initially that was very comfortable, but I found over a short period my head sunk into them too much and it wasn't very comfortable. Then I've got the memory foam pillows. They're much firmer, and those pillows with this on top, absolutely fantastic, because it like props you up and elevates your head, but then you also have that nice like the gap here that your ear can actually sit into, so it doesn't touch the pillow, so there's no pressure on it. So that was really good. I did sleep better last night. I felt like I got a better rest. I did wake up a few times because my ears hurt, and I thought that was a bit weird. I thought maybe like I was putting pressure on my ears and that's what was hurting them, but like I would wake up and I'd sort of, you know, feel around to see, like I could slip my hand under this cushion between the pillow and see if there was a gap, and there was always a gap there. Like my ears were never touching the pillow underneath. And I was thinking about it this morning and I thought, well, maybe I noticed my ear pain because my back pain was not there. Whenever I was waking up with the back pain, it was so fucking painful, like nothing else mattered. Like that was just the worst thing for me, was what was happening with my back. So when the back pain was gone, all I had to focus on was my ears. So that was funny, but I'm okay. I can deal with the ear pain. It's not so bad that it, like, I can't handle it. But the back pain, I can't do it. I can't stand it. It is literally, it's excruciating. So I thought I would check in one last time before I have my bandages off tomorrow. So it's nearly 1 a.m. on Sunday night, and I have my bandages off bright and early tomorrow morning. So today I didn't really experience much pain with my ears. This one was funny. Over the last couple of days, I felt like it wasn't getting better like this one was, and there were times when the pain would come on in my ears, or in this ear, and it almost felt like it was worse than it had been. I was a bit concerned that maybe it was getting infected, but I wasn't too sure, because I typically associate like wound infections with like pulsating and like feeling really hot. and almost unbearable. And since I'm not taking any painkillers during the day, and I didn't have any feelings like that, I figured that it was just simply taking longer to recover. I'd also been cutting back my painkillers at night, so I wasn't taking as much, but still taking them at night, because I did find like towards the late afternoon and in the evening the pain was worse. So I don't know what's up with that. Like I don't know the answer to that fucking conundrum, but that's what I was experiencing. So I haven't taken any painkillers today at all. I don't think I'll take them tonight because they don't hurt. Oh, my battery's gonna die. But the thing that I did notice today, they're itchy. They're really, really itchy, and sometimes, like, they're always itchy. Sometimes it's worse than others, and or sometimes it's worse than other times. And when they're really, really itchy, it is like, it almost drives me crazy. It doesn't last long, but I definitely can't not like touch the bandages, and typically that's what I do. I just wipe over the bandages because that is enough to sort of take the edge off the itch. I am concerned about itchiness after I have the bandages off. I'm gonna have to be super duper careful not to go in for the scratch and to only gently touch. I don't know. I'm going to talk to whoever takes my bandages off tomorrow, because I am a little bit concerned that, like, my natural instinct will be to scratch, and I don't think that's going to be something that I should be doing. So, yeah, that's pretty much how I'm going. Really excited to see my ears. Really excited. I kind of, up until now, like, I've wanted to see them, but I've been okay with waiting to see them. But now I'm like, I'm really excited. I'm so excited. Oh my god, I can't wait. I hope they're good. I hope they're good. So yeah, tomorrow is the day. I am so excited as well to wash my hair. Oh my god, I can't wait to wash my fucking hair and wash my face properly. It's been so hard not being able to, like, literally just dunk my whole face in water and, like, do a proper cleanse, because this stuff it's annoying. Oh, hello.
Oh, you're right to take that yourself, or do you want me to take it?
Oh my god.
Oh, and you haven't seen the full result yet. Oh, I should be recording this.
Oh my god. Oh my god. Sorry, this is really, like, oh god.
This is a great procedure. You're one of the many that is quite emotional when they see their results, so that's very normal.
Oh my god, wow. Oh, wow. Okay, time to wrap this vlog up. So, the last clip you just saw of me, they were tears of joy, just in case that was confusing. That was the first time I saw my ears, and I only saw them in the little viewfinder of my Sony camera, and I could see the difference immediately. And just thinking about it, it's like, oh, it's such a good feeling. My ears, like, they've always been something that, like, it was all I could see. It was all I could see when I wore my hair up. And I wasn't really teased about my ears. And, you know, if I complained in summer that it was hot and I was, like, fanning my hair on the back of my neck, and someone would say, oh, just tie your hair up. And I'd be like, oh, I don't like my ears. And people would always say to me, they're not that bad, Hayley. Like, you know, okay, they stick out a little bit, but they're little and they're cute, and I mean they are. I have quite petite ears, but it was all I saw, and I felt like because it was all I saw, it was all anyone else was going to see, and I hated it. I absolutely hated it. So to see that, like, when I turned that camera on and I pressed record and I looked at myself in the viewfinder and I was like, I don't notice my ears even though I'm looking for them, that was just, I don't even know how to describe that feeling. That feeling is like the best feeling I've ever felt in my life. Like, I would do this again 1,000,000 times over. This is stupid. Yeah, but that's how I feel. I feel so happy and I feel like an idiot crying, but I feel really good about myself right now, and that's a nice feeling. So yeah, today I proudly wore my hair up with my ears out, and there were actually times when I would be interacting with a stranger and I kind of wanted to be like, what do you think of my ears? Like, that's how proud I am right now. I am so happy, and I'm just like, look at my ears. Look at them. They're so much better, and I'm so happy. So yeah, that's my ridiculously happy feeling explanation. So now I just need to let my ears heal. I do have to wear a headband. They gave me this one and another one for 2 months at night. And they also said, like, if you're just bumming around at home, wear it then as well. So I'm going to do that. They did also suggest that I go to like a surf, dive, ski type shop and get one of those really thick like snow headbands to wear like out. So if I'm going out and I'm like, you know, a bit casual and dressed down, I can wear that, especially now in winter, because the cold can, like, my ears are basically numb. I don't really have any feeling up here. I only have feeling down here. So they said it's like good to protect them from the cold. So that's the plan there. I go back in 6 weeks for a review and to have like my final photos taken. And yeah, that's it. That is it. Something that I noticed after having, or 2 things I noticed after having my bandages taken off that might, you know, help someone, or I don't know, just, you know, the more information the better, basically. When my bandages were taken off, the itching stopped pretty much immediately. I still get a teeny bit of itching like back here where I've got some stitches still that will fall out over time, but it's not bad, and I'm not like, you know, trying to claw at my ears or anything like that, so that's great. And also all of the skin on my forehead and along my hairline was dry as fuck, like literally like flaking off dry. So that's something to look forward to when you have your bandages off. But you won't care about any of that shit because you'll have ears that aren't the most prominent feature of your face, and that's exciting. I'm just going to insert this clip because I need to talk about this headband because it's relevant to the recovery process. So as I said, I received this headband and a backup at my bandage removal party, not really appointment, it was a party for me though. And instructions were to wear it every night until my next appointment. And also to wear another headband during the day. Now, on the first night, I came home after work, took off my makeup, put my headband on, had it on for quite a few hours, and it started to hurt. My ears were hurting, and it got worse and worse to the point where I couldn't stand it. So I actually took one of my really strong painkillers and thought, it'll be fine, I'll be able to go to sleep, and it can get me through the night. No, it didn't even take the edge off. And I wasn't going to take more painkillers because I don't need them at this point. It's ridiculous, but I just couldn't stand like the pressure on my ears. So it was really late at night. It's after midnight. I got on to Dr. Google and I was seeing what people were saying about wearing their headbands at night straight after surgery, or straight after having their bandages removed. And a lot of people were saying they're really uncomfortable, and others were saying that the headbands are only to protect your ears. They're only to like hold your ears in place when you sleep, so that if you like roll over and, you know, like pull on an ear or something, it doesn't cause damage. And then I remembered the nurse saying that to me, and I was like, okay, so it doesn't have to be super tight. It doesn't have to be so tight that like it's uncomfortable. So what I did was I unfolded the bandage, because they are double layers, and I just wore it as a single layer bandage, and immediately the pressure was released and I slept like a log. The following night I tried it with it like doubled up, because when it's unfolded, it's huge. I mean, it's big now, so you can imagine when it's unfolded, it's like double the size. There's bandage everywhere. So I tried it again, doubled over, and it was good for a few hours, but then the pressure got too tight again. So I unfolded it and I went to sleep, painkiller free, everything fucking fabulous, spot on, good stuff. Tonight, I'm wearing it again, doubled up. I've only had it on for about 10 minutes. I get a bit of pain when I'm putting it on, when I'm positioning it. I've got particular areas of my ears that are quite bruised, and it hurts in those areas. But once it's on, it doesn't hurt, it's fine. So I'm hoping tonight I'll get through with the double layer. I do feel like the bandage has stretched a little bit, which is great. I think that's going to help alleviate some of the pressure. But if your bandage is too tight and it's like painfully tight, it doesn't need to be that tight. It only needs to hold your ears against your head. So that's all it's doing for me. It's just like pushing them back a tiny bit. So when I take the bandage away, you can see there the ear only comes out a little bit, and when I put the bandage back on, it's like you can only see the outline of the ear. So it shouldn't be like excruciatingly tight over an already like sensitive area. It should only be holding them in place for their safety, basically. So yeah, I just wanted to put that in, because now that I've been wearing these bandages for a few nights, I feel like it's, for me, it was something that like I was sort of stressing about it on night one, because I'm like, it hurts really bad, but I feel like I need to wear it as it is, because this is how the nurse put it on me. And like my brain just, because I was stressed and I was in pain, I couldn't like come up with the solution myself. So I feel like it's valuable information to give to people, so that you can potentially not have a stressful experience if it happens to you as well. Alright, so that's it. That's all I wanted to let you guys know about the night bandages. Actually, let me tell you something else about night bandages. They get itchy. My whole face gets itchy. Everywhere that the bandage sits, I get itchy. But it is what it is. It's only a few weeks. Alright, it's more than a few weeks, but fuck, I'll get over it. I'll deal with it. Alright, let's get back to wrapping this vlog up. So if you guys have any questions or comments, leave them down in the comment section. If they are very pressing comments, I will answer them, or very pressing questions, time sensitive questions, I will answer them as soon as possible. Otherwise, I will do a follow-up video in probably about 6 weeks and answer any questions then. For my regular viewers, regular vlogs will be back next week. I hope you guys enjoyed this video. If you are thinking about getting otoplasty, or you are booked in to get otoplasty, I hope you found this helpful somewhat. Good luck to you, and I wish you all the best. You'll be happy.